Talking with Dr. Isabel from Doctoronamission.com, and we're answering questions that people have written and health concerns that they have, how they can make some changes in their lifestyle that will mean that they won't have to go to the doctor so often. Had a question from Weetamoo in Christchurch. Now, Weetamoo says that he's got type 2 diabetes. He's had it for a couple of years now, and, well, his parents had type 2 diabetes as well. In fact, complications from that led to them dying in their 50s. Is this just a genetic thing? Is it, well, just in his genes that he was going to get type 2 diabetes and eventually it's going to kill him too? Or is there some changes he can make? Can he reverse fate in this regard?
I just learned that we can reverse most type 2 diabetes. And as a doctor, I just want to let you know, Weetamoo, that as a doctor, we're trained that, yeah, you can do a few things, but if you don't, then it's pill time and it's insulin time. And there's actually a lot of stuff we can do to prevent type 2 diabetes, because diabetes, I've just learned this in the last 3 years from doctors in America, there's essentially this road, and it's called diabesity, and it's a diabesity road. And diabesity is just the road that you go on before you hit diabetes. It can be 20 to 30 years before you get type 2 diabetes. So there's a lot of stuff that you can do in this area to prevent it. And once you have type 2 diabetes, there's a lot you can do to reverse it. We can reverse type 2 diabetes, most of it.
Some of that is genetic, or the propensity may be genetic, that if you have a family history, sometimes that means that you may get a condition that your parents had, like type 2 diabetes, but that's not set in stone, is it?
Well, no, it's not. Yes, you will. You do have it in your DNA. You can't change DNA. That's just the way God did it. But you can prevent the expression of what your DNA has. And food has a lot to do with the expression of genes in our DNA.
Something else that we sometimes inherit from our family is our habits, the way in which we respond to food, the sort of food that we eat. I mean, you know, we get served a certain food at family occasions. It becomes who we are and what we do to an extent. Some of this is genes, but some of this is perhaps bad habits that we've got into over the course of a lifetime. Those habits may be difficult to break, but the benefits are great.
Yes, habits are hard to change, but they can be changed. But you've got to make the decision. Habits are changeable.
For Weetamoo today then,
in
terms of reversing his type 2 diabetes and also preventing some of the negative side effects and outcome of that, what's a take home from him? What can he change today?
What can he change today is start losing weight. Get some of that weight down. You want at least your waistline to be less than 100 centimeters. So try and get your waistline down below 100 centimeters. And what foods to eat? Well, I always say keep it simple. Just eat the foods your great-great-grandmother would recognize. And she wouldn't recognize a Macker.
So not the fast food, not the super processed stuff.
No, not the energy drinks.
If you can grow it in your garden, maybe, then that's a good start?
Yes. And if it comes in a package, it's probably not good for you.